Frequency? Okay. And you usually combine with some injection? Okay, with micropomfus technique? Ah, okay, with cannula. And which is the result, usually? Yeah? Okay. Other one? Don't be shy. What do you use for neck?
CO2.
Uh-huh. Only CO2?
Mesotherapy.
Okay. Okay. And which kind of product you use in mesotherapy? Hyaluronic acid or did you ever use Xela for? Okay. How many people use Xelaredan for neck right now? Nobody?
It's new.
It's very new. Okay, that's great. You know that neck is a very important anatomical area, and some culture, some population, for some population, is the center of the body. Okay, you know the history of this population? In reality, it's not a good story. Okay, because they found this solution to save their wife from invasion of other population. So they had created their own aesthetic trends, okay, different from other population because of they want to save their wife during the war to be raped and taken outside from the country. So they had studied and they had decided to found their specific aesthetic trend, okay, from the neck. So this for to tell you how important is neck. Also because we have a lot of procedure for face. But neck is an area in which you don't have so much solution. But neck is important to age aspect, such as the face. You know, you can have a very lifted face, a very skin quality face, but if the neck is aged, is all lost. Okay. So the anatomy of neck is not so complicated than the face anatomy. Is a very safe zone to inject if we inject superficially between the skin and platysma muscle. Okay, in this layer you can find some small vessel, some small nerves, but if you remain upstairs respect platysma muscle, you don't take any kind of risk. The only risk you can have, for example, if you use polylactic acid, maybe is the visible of the implant because of the skin is very, very thin. So an idea could be in these cases when you have to perform, for example, polylactic acid and the skin is very thin, to prime and to prepare the skin to a second session with something else. If we use CO2, it's very different to shot energy in a dehydrated and in the skin where fibroblasts are not so active. Different is to shoot the energy where the skin is, where the dermis is very metabolic, where the metabolic activity of dermis is higher and where the thickness is most important. Also with RF, radio frequency, is the same. Why male patient usually have best result than female patient with RF? Why? Because of the thickness. Yeah, it's the thickness, absolutely. And if a radio frequency can guarantee you 30, 40 or 50% of dermis contraction, it's very different if the dermis is 1 centimeter or 2 millimeters, right? Because the percentage of contraction is upper in 1 centimeter dermis than in 2 millimeters. So we can also think about to improve dermis thickness, to improve dermis activity in order to guarantee a best result than when you treat a very thin dermis and skin. So this is a simplification of anatomy in which you can see that under the skin we have platysma, and this muscle have a very big activity, okay? Not only for the face, but for the rest of the body. And this is one of the major signs of platysma activity, as you can see. And this kind of problem usually is combined with skin laxity on the jawline or in the rest of the neck. So, as you can see in this case, there is not so much important vessel or nerves. Nerves are spreaded. It's very difficult to damage it with a needle or with a cannula. The only risk that you can incur treating the neck is ecchymosis and the implant, the visibility of implant. As you can see in this slide, all of the main vessel, like external jugular vein or carotid, is more deeper, like the other important nerves. So if you remain very superficial, if you remain in this layer, the subcutaneous layer, very thin, you are very safe, okay? The platysma is very large muscle. We have also sternocleidomastoid and trapezius, but these two muscles are not so important for aesthetic purpose and to improve skin quality or the appearance, aesthetic appearance of neck. This is an anatomical dissection. I ever believe that is the most important thing is to know anatomy when we have to inject, when we have to do something, because the perfect knowledge of anatomy permits you to understand where you are injecting and what you are doing. And as you can see, the subcutaneous layer is very thin, and under the skin we have platysma. We have platysma muscle, okay? If we create a dissection, okay, under platysma, we will see all the important veins, artery, and all the important structures. So don't go too much deep on the neck, remain every time on the superficial layer, because the danger are deepest, okay, are in the deep layer. So we have a lot of, such as the face, we have a lot of aesthetic defect for the neck, skin laxity, muscle hyperactivity, photo damaging, aging damaging. There is a lot of reason to treat neck. And as for the face, DNA, heredity, weight loss and increased loss, hormonal disorder, thyroid disorder, and posture are very important to the final result of the aging of the neck and of our procedure. Okay. Do you ever heard about inflammaging? You know what is? Okay, is a chronic low-level inflammation, okay? It's a subclinical inflammation. It's like a glass of water, okay? Daily exposure to sun, daily exposure to pollution, the hormonal decrease, all of this aspect produce a subclinical inflammation promoted by cytokines and TNF. And this daily activity is like a drop that fill the glass until our level, and when the water goes out, we have the visibility of aging defect. So is something about the patient don't have any kind of feeling, and we don't have any kind of feeling. So to treat inflammaging is very important the concept of prevention. Okay, if we use something with anti-inflammatory effect, if we use something with antioxidant effect, we can fight against inflammaging, even if we don't see any kind of signs of this problem and of this trouble. Inflammaging produce decreasing of production of collagen and elastin and other protein, and this chronic inflammation produce oxidative stress and chronoaging. Okay. So the reason because after 50 years old, you will see chrono-aging also in a patient maybe that they don't have too much photo-aging, okay? So which kind of procedure we can perform on the neck? Radiofrequency, HIFU, EPL, APL, thread lifting, botulinum toxin. I'm not so agree with the use of filler of the neck because it requires a very skilled injector doctor, and you have to choose very well the product because of you need nothing, you need something with 0 G prime, okay? Otherwise you will see the implant. So filler, in my opinion, is not so indicated. Lactic acid has a biostimulation effect, so it's not to intend like a filler, okay? Redermalization, of course, because of redermalization, fight against all of the major pathogenesis factor, and you can combine with every other procedure. Cryolipolysis. Yes, I didn't see too much result. Lipolytic injection, the same. In my experience, I always prefer to perform a liposuction than use a lipolytic. But if you don't have this kind of opportunity, also lipolytic in some situation could be okay. But the use and the combining of biorevitalization is so much important to improve retraction and the increase of skin tonicity, okay? So the injection layer also in the neck are very, very superficial, and we can perform a micro droplets technique, micropapula technique, like in this case, injecting very, very superficial, but we can also use a linear technique, okay? Which is the difference from linear technique to micropapulas technique, in your opinion?
Deeper layers.
Surely, but from an effectiveness point of view?
From an effectiveness?
Yeah?
It can last longer.
Less inflammation, so less inflammation in the skin, so lower cytokines, okay, so less raw collagen.
Yeah, that's true. But we are using something that go against cytokine. So we can balance the cytokine stimulus with the product, but the real difference is the stimulus. Which is the first stimulus when you perform a biostimulation? The needle. Yeah. So micropomfus technique is a very, very little stimulus because it's a point. You enter only with the tip of the needle, and so the stimulus is very, very small. But when we perform a linear technique, we produce a dermis detachment. So the traumatic effect is more higher, and the stimulus is more higher. So we can also think about that, and we can choose different injection technique depending on the result we want to obtain and depending from the anatomical area. For example, in periorbital area, we only need to put the product inside the dermis. Okay, so we can use a very simple microdroplets technique. But if we want to perform a lift effect, Michaela showed us, she used a linear technique. Okay, if we want to perform an effect on the neck wrinkle, we can, of course, use microdroplets technique, but if we detach the dermis with the needle, the result should be better, for sure, okay? Is more painful, is more bleeding, more inflammation. Yes, that's true, but we have to intend all of these characteristics like a stimulus, okay? So in a lot of situations, we have to choose a linear technique against a microdroplets technique. Can we speak about biostimulation with microcannula, in your opinion? There is a lot of demonstration during the Congress, the people who performing biostimulation with cannula, but where will be with our cannula? Here, okay? There is no evidence, no scientific evidence on PubMed, on the literature, wherever you search, that a product injected in this layer could reach this layer, okay? I'm pretty sure about that. I believe that if I put hyaluronic acid in this layer, something go also by a diffusion processes on the dermis, but we don't have the evidence. Okay? Why this kind of approach with cannula making good result? Because we perform a detachment, a mechanical detachment between dermis and hypodermis subcutaneous layer. And this kind of detachment, injecting a very soft pillow of product, hyaluronic acid, what you want, of course improve the result. But nowadays we can't speak about biorevitalization with cannula because we don't have the evidence, okay? So I would like to go fast for this part because Michaela this morning has shown you very well all the chemical characteristic of product, and also in this case the combining of hyaluronic acid and succinic acid. So the combining of two different factors is like love, is ever winner. Okay, and so why to use only hyaluronic acid if we can choose to combine also something like that? Because of we can work on different aspects of the same defect. This is the Xela Rederma line, 1.1, 1.8, 2.2. In reality, I don't use so much this product because of I prefer in the case when I need to use maybe Electri, but I use a lot of 1.8, 2.2 also for neck and décolletage. Okay, why? Because this kind of approach, with this kind of approach, your papilla will remain free of 4 days surely, okay, depending from 2.2 and 1.8, but the result will be great after only one session. This is the only product I ever tried that can permit me to observe a result after only one session. And this is the reason because I choose to use Xela for my patient for face, neck, and décolletage. You know, we have already seen this article, low molecular hyaluronic acid weight activates pro-inflammatory mediators. High molecular weight of hyaluronic acid activate methods that reduce inflammatory. So this is the rationale because of we can use Xela to reduce inflammation, to reduce inflammatory signs and to improve the dermis activity. Are molecular of 2.5 million Dalton, okay, so a very strong, very heavy hyaluronic acid. We know that this combination can guarantee an improvement of mitochondrial energy, antioxidant effect, activation of microcirculation, but in my opinion is not so correct to define activation, but in my experience is a modulation of microcirculation and anti-inflammatory effect. Okay, the effect of on mitochondrial, and this is very important sorry, so if you need to take some pics, okay, is very important because of we enter in the Krebs circle to produce ATP, to produce energy, and this is good for fibroblasts and for all the cells of dermis. This is the role of succinic acid against free radicals, and free radicals are other main actors for inflammaging. And there is some study that demonstrate the reduction of oxidation thanks to hyaluronic acid and succinic acid. About microcirculation, okay, this is remodeling of dermal matrix, but also remodeling of microvessels. This is the reason because when we treat rosacea, when we treat, and you also see on the patient with blepharoplasty, the telangiectasis and the redness is reducing after the procedure with Xela. Okay. Okay, the oxygenation effect is a consequence of the modulation of vessels. And also this is the difference between the activation on macrophage M1 with produce endogenous growth factor as TGF beta 1, VGF, FGF2, and activation of macrophage M2 that produce anti-inflammatory and cytokines like IL-10, IL-4, and TGF beta. Okay, we can go. This is very important. Take a shot of this one because this means why we have an anti-inflammatory effect, because xelarderm stimulates macrophage M2 much more than macrophage M1. So we will have a reduction of the production of pro-inflammatory cytokines and increasing of the growth factors and regeneration factors. So this is the very important things to understand about the use of this kind of product. We have a lot of studies that demonstrate the expression and the activity on this kind of receptor. And this kind of receptor, we will find this kind of receptor on fibroblasts, on macrophages, but in a lot of human tissues like vessel, artery, and liver. And we have some demonstration on the presence of this kind of receptor on adipose tissue cell. It's a very long wide receptor that can stimulate a lot of cells in our skin, such as fibroblasts. Okay, this is the demonstration of the dermis, the activity dermis after xelarderm, after placebo, sodium succinate, and hyaluronic acid. But the effect of the combination of hyaluronic acid and succinate sodium is very bigger than the single one. So you can see here, because in the cells treated with only sodium succinate and only hyaluronic acid against control, we have an improvement, but the improvement of the combination of hyaluronic acid and sodium succinate are higher than the single. Okay, 1 + 1 means 3. Okay, this is what justifies one of my first slide. So the effect on the vascular wall remodeling with the control, hyaluronic acid, and the combination. The concept is ever the same, and the result are that after 1 day, 3 days, and 7 days, all of the production of FGF2, VGF, and TGF beta 1 is higher with the hyaluronic acid plus sodium succinate, for the exception of the TGF beta 1, where the maximum stimulus is from sodium succinate and not from hyaluronic acid. Okay? So photoaging hyperpigmentation is one of the most important aspects to treat and to improve for the neck of our patient. And we can use laser, we can use peeling, but the best way, in my opinion, is to combine, as I told you, all of this procedure with the combination of succinic acid and hyaluronic acid. This is the rationale behind the use of xelarderm in hyperpigmentation, and you have to try it. If you will try it and if you inject correctly, very superficial, and you will control your patient after 2 weeks, 3 weeks, I'm for sure, I can bet with you about that, your patient will tell you, I'm not an improvement of lightness. The skin is more hydrated, okay, there is more tonicity, but the most important aspect is the reflection of light, okay, and every patient note this, Okay, so you can be sure, you have only to try it, and you will remember this war and this day when I'm showing you that all the patient seems the difference is lightening. Okay, very important. Okay, we can go. I don't want to bore you so much. Of course, you can use on hyperpigmentation. In my opinion, for hyperpigmentation, it's better to use other kind of procedure. Laser are the best, surely. Peeling, but maybe some patient can't receive this kind of procedure for a lot of reasons. The first one could be the downtime after the procedure. After the downtime after procedure with scleroderm is very, very short, okay? But once a time, if you combine procedure with injection, the result will be better, and the patient not only feel the improvement of, for example, for the hyperpigmentation, but surely they will feel the improvement of the total lightening of the face. So this is very important. Let me show you some image of dermis before the procedure. As you can see, we have a lot of black island. Okay, it's not so homogeneous, the pattern of this dermis, very different from this. Immediately after the redermalization procedure, very different from this, where all the fiber are better organized and the black island are not so distributed and not so merged like in the before procedure image. Very important to understand that hyaluronic acid is concentration is ever the same, and we can sorry, I think that from the sorry, okay. This is the scleroderm unboxing, but you had already seen this morning. You will find your vials, and you will find 2 needles, 2 BD needles of 30G. But once a time, you can choose the needle depending on the effect you want to obtain. We had said that the first stimulus is injection, the first stimulus is needle, so it's different to use a 30 gauge needle or 31 or 32, okay? Because of the diameter is very, very different. This is a 1 ml vials, but my suggestion is to use 2 ml. And as you can see, the concentration of succinic acid is ever the same for all the product, and what changes is the concentration of hyaluronic acid. This is the reason, because if you inject 1.8 micropomfus will remain maybe 2 days. If you inject 1.1, only 24 hours, maximum 30 hours. If you inject 20.2, the pomfus will remain also for 4 or 5 days, depending by the thickness of the skin. So usually I use 1.8 for very thin skin, and 2.2 where the thickness of skin is bigger, okay, is higher. So this is my decisional criteria, the thickness. Also on the neck, I can use 1.8 and on 2.2. You can choose your preferred technique, but today we would like to propose you a new approach technique for the neck, and could be very interesting. Maybe start all together to try this kind of technique I will present you in the practice, to observe the result, and maybe in the future we can share our case in a publication, or we can discuss about the result we have obtained. This is the classical approach, is not the new one. So I like ever, draw and paint my borders of injection, and until now I haven't performed a micropomfus technique on the neck. As you can see, this is a patient, and then I will show you the result on this patient. As I told you, we can choose between 1.8 or 2.2. In this patient, if I remember correctly, I had injected 2.2, okay, 2 ml, 1 ml for each side, a lot of product, okay? But as I had demonstrated in the practice session, there is no bleeding, are very, very superficial injection. Okay, it's quite boring, I know, but sometimes we need also to be bored because of sometimes our work life is stressful. So I'm happy sometimes to perform also boring technique, but it's the simple and the handset injection technique of aesthetic medicine, and we don't have to forget it. Okay. Okay, this is the amount of volume. The patient is injected a lot, as you can see, but redness will disappear in a couple of hours, and the day next, the first one, pomfus are not so clear, but start to merge, okay? So we will arrive at 4 or 5 days, and the pomfus are totally merged. So this is not the situation after the second days, is the immediately after situation, but right after the first or 2 days are not so visible like that. And here, one? Yeah, I always told to my patient, try to follow each point, and you will see a very big picture appearing from this kind. You know, the kids playing on.
Do you use only one needle, or you change the needle?
It's depending from the thickness skin. Sometimes after the first ml I need to change the needle. Sometimes I complete all the session with only one needle, but if you have to treat more than one area, my suggestion is to change needle for each area or for each side of area, okay? 2.2 is quite difficult to inject with 31 and 32 gauge needle. For the 2.2, I suggest you to use 30 gauge needle, okay? More simple for you. You can also do with 31, but you can perform only one region after you are very, very tired to continue the injection, okay? So it's not so useful. This is the patient that you see the injection in the previous slide, okay? And in your opinion, after how many sessions we'd obtain this kind of result? 3 sessions. One. I had chosen to use Xelaraderm 4 years ago because it's the only one product I ever tried that can permit to observe result after one session. This is, I swear, this is the result after only one session. Okay, we have to analyze this patient. Perfect indication, okay? Obviously, if you have a very fat neck and submental, with the result could be not the same, but this is the perfect indication to use and to promise to your patient the result after only one session, okay? As you can see, wrinkles are not totally disappear, but global skin quality is very, very good and so nice. Yeah?
No additional treatment?
No, only there, only Xela 2.2, okay? Obviously, if you combine with the other procedure, the result could be greater on skin tonicity, on wrinkle, but this is, in my opinion, a good result. Only one vials and 2 ml of product. The same is about décolletage. The concepts are the same. In the neck, we can also inject with linear technique. This is my new proposal for you for the practice of this afternoon. I believe that on décolletage, our purpose is to improve skin quality, is to improve hydration, so we don't need so much mechanical stimulus. So in my opinion, we can clearly choose a microdroplets technique. Boring, but very safety and very effectiveness. Okay, I will show you in the practice, and this is the same patient that I show you in the previous slide, but this is the result after 4 years, because this wait a minute, these pics are about 4 years ago, okay? And I don't treat this patient in this period of time. Then she came back. She's my colleague, is an esthetician. So I treated another time only 1 session with 2.2 on the neck and on the décolletage. As you can see, the result is the same of 5 years early. Okay. Only 1 session without any kind of other procedure, a little ecchymosis after 1 week, but who cares about that, okay? The same patient in the décolletage area, and as you can see, okay, we have an improvement of wrinkles, but we have an improvement on skin quality and lightening, okay? The light is the same. Tell me.
How long does the effect last?
The long lasting is depending by the number of sessions. Okay?
If you do 1 session,
If you do 1 session,
on the left, for how long?
maybe a couple of months, maybe. Okay? I don't really know because, okay, this is the only patient that I treat only 1 time usually, and this is the reason because I show you, but usually after 50 days I perform the first session, then I wait 50 days, I perform another session, then I wait 30 days or 50 days depending from the situation, but usually I perform a series of sessions, so the result will become long-lasting, okay? But in my opinion, it's reasonable to think about that only after only 1 session, the result will be remained 1 or 2 months, okay? But it's normal because for the metabolic effect, you have to wait. For succinic acid effect, metabolic effect, you need to wait. Hyaluronic acid permits you to observe immediately result, but you know, when hyaluronic acid is totally absorbed, the skin start to lose hydration, and you have to add to inject more, okay? And other cases, also these cases after 1 session, only 1 session, as I would like to underline the common result: lightening, tonicity. Okay, wrinkles are okay, are improved, but when you see this image, the impressive factor is the lightening, the skin lightening, and will be the same that your patient will tell you after the procedure. Same patient for the neck for décolletage, okay, micro wrinkle, another neck. I'm showing only 1 session procedure, okay, in all of these cases. This is a younger patient, but as you can see, the improvement is nice. Also on décolletage, maybe better in this case on décolletage because skin quality has improved a lot after this section injection. Some cases from my colleagues. This is a colleague, Maria Gabriella Di Russo, is a large user of Xelare Derm in Italy, but she don't inject so much like I inject, but the results are so good, not in the same way, but also good, and you can use also for stretch marks, okay? In your opinion, which is the best technique to use with stretch marks? Which is the best injection technique for stretch marks? What is stretch marks? but you are very deep. Linear technique. You perform stretch mark. In my opinion, stretch mark is very similar to a scar. It's a scar. Okay? So we need to detach the scar. So this detachment permit you to observe an improving, and then we inject. So we combine subcision and biochemical effect of the product. You can also inject with micropomfus, but for example, where is more suggestible micropomfus technique in a stretch mark?
Fresh ones.
Yeah, when they are very red, when they are very fresh, where inflammatory action is too much. So we don't have to stimulate too much with mechanical effect the inflammation. We have only to put the product to fight the inflammation. So when we have fresh stretch mark, we can use micropomfus technique, microdroplets technique, but when we have white stretch marks, okay, we have to improve the stimulus and we have to improve regeneration. So different technique for different scope and purpose, okay? So, a unique formula that can permit you to improve hydration, to improve immediately hydration, to improve immediately skin tonicity, waiting for the succinic acid effect that you have to wait maybe 2, 3, or 4 sessions. This is me 10 years ago when I started to use Xelaraderm, and this is I after the procedure with Xelaraderm. I'm joking, but I would like to thank you for your attention, and we can go to the practice, okay? Okay. We will have only one patient?
Yeah.
Nice to meet you. I'm Marco. Nice. Yeah. How do you feel? Are you relaxed? Yeah. Ah, sì, perfetto.
But nobody will understand.
Meglio. Ma
Stavo imparando greco.
ah sì? Ma come mai parli italiano? Perché sei stata in Italia, hai lavorato in Italia?
Ho una predilezione di parlare...
Le lingue?
Di imparare, sì.
Quindi ti devo portare con me in tutti i miei tour. Perché...
Parlo in inglese al lavoro ogni giorno.
Ah sì?
Anche quando vado a casa...
Allora abbi pazienza per il mio inglese un po' poveretto.
Quando
Tu lo
non
sai
sai
che gli
qualcosa,
italiani,
mi dici in italiano.
esatto, tu sai che gli italiani non parlano l'inglese.
Lo so.
Ma io sono abbastanza un'eccezione, ma per ragioni professionali.
Anche i miei compagni di lavoro, perché alla compagnia dove lavoro abbiamo presenza in tutta l'Europa.
Ah.
È stato i francesi e gli italiani per loro con il
No, sì, i francesi, no, i francesi sono ancora peggio degli italiani. Anche perché loro non lo vogliono fare per una questione di principio, no? Ecco, quindi è ancora peggio. E anche gli spagnoli non sono skillatissimi.
We have 3312.
Okay, I have it.
30 or 33.
Can you help me with this one, please? A really professionist ever travel with the right instruments. You know?
Yeah.
Allora, non sarà una procedura particolarmente dolorosa, ok? Poi c'è su la crema anestetica, quindi possiamo stare tranquilli. Però la cosa che devi sapere sicuramente è che... Ah, sorry, because of the patient speak Italian, so I forget it where I am. Okay, sorry. So you have to know, no, is quite important because it's the same concept you have to pass to your patient when you have to treat it. So painful is not, the pain is not so much high. We had applied an anesthesia cream, but usually in my daily activity I never use anesthesia cream, okay? Usually my hand is very soft and my patient doesn't need to apply the cream. It's something that for me is a complication of the procedure. Much more time, and I will use a very, very thin needle. We will use a 31 gauge needle for Electri and 30 gauge needle for Xelaraderm. Now, before to start, we have to decide which kind of Xelaraderm we have to use, okay? We have to evaluate the thickness of the skin. Is a good thickness. Is not so much. I will use 1.8. Is also the first session for this patient. Yeah, only one side, please. Only this side. Okay. These droplets, these pomfus, we inject very superficially, so we will perform a pomfus. The pomfus is the product, okay? So we have to wait 2, 3, 4 days, sometimes also 5 days to observe the totally recover of the micropomfus, but in reality, much more time the pomfus remain, much better will be the result, okay?
For me, it's the first procedure ever, so.
Yeah, so be patient about 3, 4, 5 days. And I told you downstairs that the proposal of today is a new approach combining Electri and combining Xelaraderm. And this approach will be using Electri to treat the linear wrinkle. And please tell me which kind of technique is more suggestible to treat this linear wrinkle with Electri. Will we use microdroplets technique or will we use linear technique? I'm waiting for you. Doctors?
Linear technique.
Oh, perfect. Yes, that's right. Linear technique for the lines, for the line wrinkle, and we will use Electri with a 31 gauge needle, okay? Then we will proceed with microdroplets technique in all the rest of the area with 1.8 Xela, okay?
2 milliliters.
2 milliliters. Okay.
Adesso un bocca al lupo.
In bocca al lupo. Okay, we can start the injection. We have to clean and to remove all the cream and to perform antiseptic. Okay, I ask to you to turn a little bit your head on the other side, like that. Okay, and we have to produce skin tension, skin tightening with your hand, and then we can start with our injection of Electri. Okay, I have to follow all the wrinkle I don't use so much product. I don't want it so much visible, the implant, but we need 0.1, 0.2, 0, sorry, 1 or 2. Okay. How is the pain?
Not feeling.
Okay. We didn't pay the patient to...
Am I allowed to laugh?
Okay. Okay. As you can see, we are performing subcision dermis, and in the same time we are injecting. So this is the combining of mechanical effect and biochemical effect. So we can work on this linear wrinkle like that. And as you can see, I'm very superficial. We can see the needle shadow. We can see the whitening, the skin whitening when I pull up my needle. And this is the demonstration that we are very, very superficial. If you are very superficial, if you are correctly superficial, the risk of ecchymosis will reduce a lot, okay? So train yourself to learn how to inject superficial, because it's not so simple like could be seen, ok? Ho detto bene? Grazie. Okay, we can go. As you can see, very, very superficial. We can see how our Electri injected. Okay. This was 1 ml or 2 ml of Electri? 1 ml?
1.5.
1.5. Okay, I need another syringe. You know where is my needles? Do you know where is in my bag? Okay. Okay. There is some questions about that for now. No question.
We don't buy.
Okay, no, you have to pay someone for the questions. Not only the patient, but also the doctor. Okay. Really? Is the white bag? Okay. We had injected 1 vials of Electri, 1.5, only for this side. Oh, true. It's a fit. Maybe on the desk? Yeah, it's there. Okay. So we had finished the first vials of Electri vials, and now we will perform. This is, as you can see, come very close, please. Okay, remain like that. 1.8, okay, 2 ml. We are using a 30 gauge needle, and we will proceed with micro-Ponfus technique. Okay, so let's start. Very superficial, as I show you in the video, in the previous videos. Okay. As you can see, the first evidence that you are very superficial is that when you start to inject, will appear the Ponfus, like that, okay? So you are very, very superficial, and as you can see, there is no bleeding, but we don't need too much traumatic, too much mechanical stimulus by the needle. We only need, in this case, to inject our product in the superficial dermis layer. Okay? As you can see, some little ecchymosis, but it's okay. We are doctor, we are injecting, so it's normal to have some ecchymosis. I have to admit that this patient is so good because she don't feel anything, but also because is okay. It's not so okay. It's not so stressful. Okay. I have also a patient who speaks Italian, so I'm very lucky today. Okay, please turn on the other side. Okay, much more is the skin tension. Much better will you perform the PONFUS and the injection technique. You need to stretch skin in order to more be simple to inject very superficially. Okay, like that. Okay. So combining product and combining injection technique to involve a better result with two different aesthetic defects. Not in this case because really this patient has a very young skin, only a few wrinkles, but is normal. How old are you?
48.
48, compliment. Very good skin, with a good oxygenation, and if all the patients were like you, we don't work.
And I'm not using any kind of creams or lotions or...
No, this is DNA. This is your natural... Okay. So, we had performed one side, and as you can see, I had used a half vial, so 1 ml. Reality is 0.9, but there is no difference between 0.9 and 1 ml. So half vials for one side for the neck. If I want to treat also décolletage, I can use the other half vials for this side, and we can start. Maybe this could be more painful.
I can feel it, yeah.
Okay, yeah. Décolletage is more sensitive than neck. And perform a skin stretching in order to reduce pain and to be sure to inject very superficially. Okay. I will go quite faster. I don't want to bore you too much. So we had skipped the draw passage, but it's not so important because we can see very clear where we have to inject. Okay, and also in this case, as you can see, there is no bleeding. So I'm very, very superficial, okay? Some questions? No. They are all at the coffee bar and drink coffee. We are alone. Okay.
I look like a panther, huh?
Yeah. Unfortunately, Halloween is already finished, yeah. But you can do it for the next year. Okay.
How many sessions of this?
Oh, you can perform one session every 20 days, okay? Or if in this, particularly in this patient, I can propose one session each month, okay? The skin is very good with a good hydration, a good tone, so she don't need too much. For this patient, I can suggest one session each month, but for situation more compromised, we can inject 2 or 3 times each month, okay? It's depending. Thank you. We can change side. Please remove for me the cream. I'm available for you for some questions during this time. What do you think about this combination of linear and micropomfus technique changing Electri and Xela? What do you think? Could be a good idea, is something that you could use in your daily activity. Would you like to start to collect a case series to share all together and to demonstrate the efficacy of this kind of approach? What do you think? Give me the proof that you are alive, please.
Yes, we are.
Okay.
Yes, we are. People easy here, not everybody is human.
Ok. Detto con quel tono però non sembrate molto vivi, se posso dire. Da qua non si percepisce l'entusiasmo. Scherzo, ovviamente. Ok. So, let's start in the same way. Okay. As you can see, I'm using all of my 10 finger because with non-dominant hand I'm performing skin stretching. Okay, it's very important. It's the first I'm telling for a rookie injector. The first is skin stretch. This helps to reduce pain and to improve the possibility to inject very, very superficial, okay?
If we inject this linear technique on the neck wrinkles with, for example, 1.8, it would be maybe too much, or 1.1?
I suggest the use of Electri because of the implant could be visible for much than 4 days using 1.8 and 2.2, okay? But in this case, we balance the lower concentration with the mechanical stimulus. So, of course, you can use also 1.8 or 2.2, but the rationale to use Electri is to balance the low concentration of hyaluronic acid to the mechanical stimulus. Of course, if you will use 1.8 or 2.2, the result could be better, but you have to advise the patient about the
Long-term loss.
yeah. And also for rookie doctor, this kind of approach is more simple. Now I can show you. If you give me a cotton disc, please.
Like this?
Yeah. I will show you something. Not now, when we arrive at the end of the side. Because we have to think about rheology. Rheology are not only for fillers, for cross-linked hyaluronic acid, but rheology is a physical law that you can apply to all kind of gel, okay? So, also in this product we have a G prime and we have a tan delta, okay? Is the spreadable factor. So, can you prepare another vial, please?
Electri,
Yeah. Because I would like to show you something and I need much more product. Now you know where is the needle?
No, I can sleep.
Okay. Also my colleague downstairs, you know? Sometimes I'm so boring, I know. Okay. Pay attention to the needle, please. Take care. Okay, I want to show you this. If we perform a linear injection with Electri and we put a lot of product, like in this case, okay, can you give me the cotton disc, please? And we try to spread, we can do it, okay? Now I will show with 1.8 when we make the same injection. Can you give me please 1.8?
Uh,
And I will need another one. If I use 1.8 and I perform,
2 milliliter, yeah?
yeah, okay, an implant like that, and we try to spread is more difficult. This is the reason because I prefer to suggest Electri for this kind of approach and Xela for microdroplets technique. Okay, maybe in my end I can perform also with 1.8, but I'm an injector since 2007. For a rookies injector, this less spreadable of 1.8 could be something of risky or could be something of critical. Okay, so you can use, but surely with Electri is more simple. Okay, is clear?
Electri or
1.8. Thank you so much. Okay, I need one more clean, please. Okay. So we finish our procedure, injecting the other 2 ml. And so our patient is ready for a party tonight.
For a sleep.
Okay, take this one, please. Okay. So, skin stretching and go. Is a new needle? Is a new needle, this one?
Yeah.
Okay. It's not so good. Okay, no problem. I will use it. I will change when I will finish the neck, okay? For décolletage, I will change the needle. You know, when the needle is so thin, you can try 100 needle, and in 100 needle you can find one that is not sharpened like the other. And for me, it's not a problem, but this characteristic could give you the possibility to inject more deep, okay? Because you need more energy to cut the needle, the skin. Okay. You know, I call it my 7 o'clock p.m. procedure. Yeah, because after a full day, maybe very stressful full day with a lot of maybe difficult injection or surgery, have the possibility to take calm and relaxing with a very simple technique is not so bad, okay? So I organize my agenda considering this kind of characteristic. I treat in the morning and in the first afternoon the most difficult patient, the most difficult procedure, and I will leave for the evening or late afternoon control, biostimulation, this kind of approach. Because we are human, so our concentration can be at the highest level all day long, okay? So also this is something to think about in order to improve your patient fidelization and to improve your result, but to improve your quality of life. This is the most important thing. It's a nonsense, for example, to perform a tear trough procedure at 7 o'clock p.m., okay? You will be very tired, so you don't have the same precision. After the procedure, in 2 hours, 3 hours, the patient will go to sleep, so he will not standing up, but lying, so the risk of edema is increased. So think about what are you doing and manage your time in order to reduce the risk of side effect and in order to use your best concentration period, that is in the morning, early afternoon until about 3, 4 or 5 o'clock. When I was very young, I didn't thought about that, but nowadays it's very important. And I would like to share you my experience. So I have to tell you everything what I think. I'm honest. Okay. How are you, my dear patient?
Great.
Great.
Thank you a lot for this.
So there is no area we have to avoid.
No,
The neck and
no,
decolte.
no, no. Is everywhere safe. Is everywhere very safe. The big vessels are more deeper than our injection layer, so we are not taking any kind of risk. This is the reason because I suggest you, and I call it my 7 o'clock procedure. Okay? For example, when I perform a nose filler, I do it only in the morning, and the patient remain in clinic 2 hours after the procedure, because I need to be sure about vascularization, I need to be sure all the arteries are okay, and you don't see it in the first 10 or 20 minutes. In a lot of time, the vascular problem will appear after some hour or some days, the day next, okay? So for nose, for example, my patient remain in clinic 2 hours, I treat in the morning, and early afternoon they go to home, okay? And this is more sure. Because when they leave clinic, we lost the control on the patient. We can't know anything. And the patient doesn't recognize the first vascular occlusive signal, because it's very similar to ecchymosis. A lot of doctors with the WhatsApp images could be very difficult also for us to distinguish between an ecchymosis or a vascular occlusion. So it's very important to bring the patient very close to the doctor and to control before they exit from the clinic. Okay? I also can suggest you to shoot some pics before the exit from the clinic of the patient, because you have the proof is all okay. This is an old wolf advisor. Okay, what do you think? We have used all of 2 ml, 1 ml for neck, 1 ml for décolletage. I'm speaking about side, okay? So we have injected total 4 vials. Yeah, 2 of Electri and 2 of Xela 1.8. Yes, it's not, but this we opened this vial only to demonstrate, so 2 and 2. Yeah, 2 and 2, 2 and 2. Okay, we can wait some minutes. I can show you the patient downstairs, because I think maybe in the monitor is not so clear the difference between the first side treated, where the redness is disappearing, and yes, I will use, and the side just treated where we have some redness. But as you can see, the redness will disappear very, very fast, and the redness around and surrounding the pemphuls tomorrow will be totally disappeared. Okay, but we are so gentle. We are so good, so we want to improve this redness reduction. Nice disc, please. And so we will apply Daily Deluxe, is an anti-age and anti-inflammatory product that we can use in order to improve the experience after the procedure. Okay, please close the eye. Okay. It's not mine, so I use a lot. Okay. And we can leave to dry and wait some minutes. At this time, if you want to combine some procedure and if you have, for example, LED technology, we can also think about to put our patient under the LED energy, under the LED light, and maybe to treat the face, but also for neck and décolletage. It could be an option? Yes, absolutely yes. I don't want to suggest in this phase the use of laser or other energy device because of is enough. What we had performed is really enough to see the result after the first session. Okay. We are coming downstairs so we can show you the patient. La faccio vedere così, così si spaventa subito e non si spaventa dopo. Hai visto? È tutta ponfuta.
Ho visto giusto.
Comunque le dico una cosa. I left you a message on your skin. If you, with a pencil, if you connect all the ponfus, you can read the message. Ok? This is.
Perché sei qua, ti prego dammi un'opinione. Devo tagliare o non devo tagliare?
Okay, the patient are asking me if there is an indication for blepharoplasty, right? This is your question?
Yes.
Okay, you have a very light indication. Please remain with open eyes. Okay, we have only a little indication for this skin excess, but indeed I think that with the you can obtain a good result in this situation because of the skin excess is very, very small, also with injectable solution. So in my opinion, is not yet the moment to go to surgery room. But if you want to solve the problem like that in only one session, is the time to go to surgery room, okay? It's up to you in this case, okay?
I tried and two surgeons told me to go home.
Go. Yes, it's not so much because you don't have so much skin. Is only a little bit. If you perform, for example, botulinum toxin on your forehead, injected in order to obtain a highbrow lift, you can have a good result and a good satisfaction for you. Yes, we are in a very early moment for surgery. It's not contraindicated, but it's not so much indicated. Okay?
Okay, thank you.
Come on, you are welcome.
L'ho sentito però non ho sentito.
Dobbiamo andare più veloci, ma... Ok. You are here. Okay. So this is the patient. As you can see, the redness is disappearing. It's very fast to resolve. What do you think? It's a very simple approach. Every one of you can do it. In my opinion, during this training, it's very important to give you the right instrument to start the procedure the day next, okay? It's not so useful. I will show you maybe tear trough, a very complicated technique if you are not so skilled because it's only a loss of time. With this kind of approach, you can start tomorrow, maybe tomorrow no because it's Sunday, but on Monday surely. And you have the guarantee to have a very simple technique, very safe, but this is not against the result because you will surely observe the result after the first session, okay? You have only to choose correctly the product, so 1.8 whether the skin is very thin, 2.2 when the skin is thickness. In this situation, maybe we could choose also 2.2, okay? Linear technique with Electri, very, very simple, 31 needle, no pain, no kind of other problem or traumatic problem, and I'm sure that the patient will be observe the result in lightening, in skin tonicity, and in something else. Yes, it's perfect. Tomorrow will be the pomfus will be visible, but will not so red. They are the same color of the rest of the skin, and in 3 days pomfus will disappear and surely remain maybe some ecchymosis, okay, for 5 or 6 days.
I will look more interesting.
Yes, absolutely. This is an injection session, so it's quite normal. Okay, do you have some questions? Cream? Is a spray. Yes? Yeah, you can use it. Yeah, you can also measure. Yes, I don't message at this time because I would like to show you the patient, but you can. Don't message too much because we don't want to spread the product, okay? It's very important that the product remain in the droplet, remain in the pomfus. Yeah, a soft massage is good, not a modeling massage, okay? So, we had finished? Ok, we're finished. Thank you so much. Thank you. Thank you so much. Grazie, grazie mille. È stato un piacere mio. Mi ha finito troppo presto? Va bene?